All right. So welcome to this week's coffee chat. We have Claire Sachs here. She is with the American Board of Internal Medicine Foundation, and she'll be talking with us about trust in healthcare. First, let's do a little check-in. Go ahead and tell us your name, where you're calling in from, and what's the best piece of advice you've been given. And we'll start, top of my list, I have Teresa.
Oh, that's a tough one, especially after lunch. So I'm Teresa. I am from Dayton Children's in Dayton, Ohio. I'm a family partnership coordinator. And the best piece of advice that I have given, do you mean in your personal life or in your professional life, or does it matter?
It doesn't matter. Anyone.
Always to be neutral and be open to listening.
I like that. Thank you. Keep an open mind. Sherry.
I'm Sherry Binns. I live in Rhode Island. I'm working with the Aging Initiative, and I'm also the patient healthcare liaison for the Multiple Sclerosis Foundation. I think the best piece of advice that I was given and that I now give is whenever and wherever possible, walk in the shoes of the person that's in front of you.
That's a good one.
Secretly, I'm just keeping all this advice for myself. So. Stephen.
Hey everybody, I'm Stephen Hoy. I do stuff around PFCC partners. Best piece of advice I was given professionally is God gave us 2 ears and 1 mouth, and we must use them proportionately.
That's a good one. Thank you. Nancy.
Okay, unmuted. I just told my buddy, I said, well, I'm trying to talk, please don't whistle, but I adore the whistling. I think maybe the best piece of advice, and it relates to what I just heard, be willing to listen, and it fits in with putting yourself in the other person's shoes. And I only use that advice some of the time.
Thank you. Thank you. Michelle.
Hi, everyone. My name is Michelle Kiefer. I am the Patient Experience Manager at SIU Medicine in Springfield, Illinois. The best piece of advice I have been given is to always live life with your heart and your gut. So far, it hasn't gotten me in too much trouble, so we'll keep following it.
Thank you. Lana. Alana, are you there? Or is it Alana? Sorry. We'll move on to Lindsay.
Hi, good morning, everyone. I'm Lindsay Galley. I'm the Director of Education at PFCC Partners. I think the best piece of advice that I've ever been given and that I primarily live my life by is don't sweat the small stuff.
That's important.
Mm-hmm.
Thank you. Lucero, I know you just joined us, but do you want to introduce yourself and let us know what the best piece of advice you've ever been given?
I'm trying to unmute. Oh, there it goes. Okay. Good morning, everyone. Having a little bit of trouble with Zoom this morning.
Hi, everybody. Libby's here too.
If I could start my video, you would be able to see Libby here right behind me. Okay, I'm gonna just,
That's okay.
there you go. Okay, I just want to introduce myself while my video gets started. My name is Lucero, and I am the office administrator here at PFCC Partners. This is my second week, I believe, my second week here, so I'm excited to be here. Before this, I'm not sure, I might have introduced myself to some of you here, but I was in education before this, and then before that, I was in social service. So that's a little bit of my background, and I would say the best piece of advice I ever received, slow down. Slow down. We go a little fast sometimes and we expect everything to be super fast, and sometimes we have to just slow down. Sometimes life makes us slow down, but I think if we can find that space for ourselves to take a pause, I think that's really nice. And the person who gave me this advice, I think, was also very meaningful. So I really took it to heart.
Wonderful, thank you. And thanks for joining us. Libby, do you want to tell us your best piece of advice?
Yeah.
Hi.
Your best piece of advice you've ever received.
The best piece of advice I ever received was from my mother when I was young, and that was focus on the process and the product will come.
I was saying earlier, I'm putting all of these pieces of advice in my brain, so I'm just taking everyone's advice. I'm Laura Jackson, and I'm the Community Director for PFCC Partners, calling in from Eugene, Oregon. And the best piece of advice I've been given is to trust your gut and trust yourself. It's simple, but it pops up all the time in my life and work and everything. So I feel like that's the best piece of advice I've ever been given, because it always comes up. And finally, we have Claire.
Hi, I'm Claire Sachs. Let me start with the piece of advice. Everybody's so sincere this morning. Probably the best piece of advice I ever got was don't go to law school. From someone in law school. So anyway, I thought I was headed in that direction for a while, and they said, unless you really want to practice law, don't use it as a foundation for anything else. And that was actually good advice. I just want to do a really quick point of clarification. I'm with the ABIM Foundation in the capacity as someone who sits on their patient advisory board. I don't actually work for them, but I'm pretty close to the person who runs that board, as well as some of the research that they're doing. So I just want to be clear about that. I'm a patient advocacy blogger, and I'm building a healthcare experience consultancy of my own. So yeah, that is,
Thank you.
that is the capacity that I am representing.
Thank you.
Sure.
And actually, before we get started, real quick, I see Alana's back. If you want to introduce yourself, Alana. Sorry.
Hi, can you hear me?
Yep.
Yeah.
At work. So that's what kind of pushed me to come, because I was like getting pushed from a bunch of different places. So I was like, okay, let me go ahead and do this. And best piece of advice I think for me was the best thing you could give the best gift you could give yourself is a nice body. I think that was good for me, because a healthy body creates a healthy mind, and a healthy mind creates healthy environment. Healthy environments creates healthy outcomes.
Thank you. That's perfect. I love that. You got to start there. Always have to have a good place to start. All right.
Yeah.
Now we could go ahead and get started. and about trusting
Sure. So as I got started in my journey towards healthcare, for the first several decades of my life, I didn't really want to talk about my own experience. It's very broad, and it turned 39 last month. But one of the things that I was thrilled to have happen was I was invited to sit on a patient advisory board for the American Board of Internal Medicine Foundation. And they had been working on an initiative called, what is it? It's about decision making, sorry, choosing wisely. And that's sort of about patients being able to have shared decision making when they want it, as well as what informs patient decision making. But they'd taken a look at it and thought, well, this goes a lot deeper than shared decision making. And as I thought about it, I realized that as well, that there is a fundamental lack of trust in almost every aspect of healthcare. And that's what makes things difficult on nearly, when we think about what's wrong with the healthcare system, if you look deeply enough, a lot of it has to do with lack of trust between stakeholders. So I'd like to start giving a few examples of good and bad. One very recent example was a discussion I had where I was the only patient at the table, or at least the only person in their patient capacity at the table. And there were a lot of decision makers at the table talking about when to tell a patient that their test results indicated that they might have a certain disease. And I couldn't believe what I was hearing, because everybody was talking about this as if it were normal, as if the doctor or whatever clinician they were saying shouldn't immediately release the test results of the patient to the patient. And I pushed back, and, you know, there was some agreement, but I got a pushback to my pushback saying, well, if it's something like leukemia, then, you know, the wait is agonizing. And I thought to myself, but what happens if that person is actually positive? Are you going to sit down and have a conversation with them that says, you have leukemia, we knew 10 weeks ago, but we didn't want to hurt your feelings? And I that was very shocking to me. Earlier than that, I'd had an experience where, even as a fairly medically educated teenager, I had a provider who would send me out of the room and talk about my treatment with my parents, which is not a good way to build trust. But then there are the good experience where I've had providers who have been so non-judgmental that I could push hard. I could, you know, for lack of a better word, act out, and they were still there for me, and they still encouraged me to be who I was and ask questions and be able to say no. And that allowed me to build trust in that provider, as well as to understand what to look for. But if you look at it in a broader way, say looking at industry, both insurance and drug companies, or actually any industry that's healthcare related, the lack of transparency fosters a lack of trust, because the stakes are very high in healthcare, as you know. So when we can't tell that we, the end users, are the priority for industry, in fact, that we have been told either explicitly or implicitly that we're not, it makes it very difficult to trust that these entities, which literally hold our lives in their hands, have our best interests in mind. So it's hard to do what they ask us to do, whether, again, that's insurance or drug makers. You might not trust something that comes out of a particular drug maker if you've had a bad experience before, or device makers, or even hospital systems. So in the work that I'm doing with the AVEN Foundation, they're trying to take a very broad look at that. And part of it is this idea at the center of the work that we're doing now of psychological safety. And forgive me, my notes, I wanted to get exact definitions. So there are 5 pillars of psychological safety: are confidence, trust, voice, engagement, and knowledge sharing. So those are the things that we've determined are what we're looking for to create a model that will encourage both patients and clinicians or hospital systems to approach the patient clinician relationship with. And if we can figure out a model that we can apply to all the stakeholders, then we start rebuilding the trust that we've lost. And I will always maintain that communications being a large part of that. If we don't do that, no matter how ideal our healthcare system is, we're not going to get the treatment that we need or that we deserve. We can't communicate if we can't trust. And that trust has to go in both directions. There are certainly things that I did when I was a teenager that would cause my clinicians not to trust me. You know, like the 16-year-old type 1 diabetic teenager who got caught with a Hershey wrapper under the hospital bed. So it is kind of silly in a way, but I'm sure that the provider I had at the time was like, obviously this patient isn't listening to anything I have to say, and she didn't take this track, but what's the point of giving her my best when she's going down this path? And that, you know, is a very human reaction to that kind of thing, but I'm sure I did not foster trust in my clinicians at that point. So the work that the AVIM Foundation is doing is trying to formalize, trying to find the right language, find the right structures, where even within a team building environment with the clinician team, starting to bring in patients to be part of that team. And so when patients are part of that discussion, whether, you know, they should be the majority because they're the majority stakeholder here, but it becomes more of a discussion of what's going to work. Things like, okay, I've just spent, you know, taken a day off work when I can't really afford it. I've taken a bus halfway across town. I've hired a babysitter for my child, and I go in and I have this experience that is not ideal. And have I just wasted my time to fix an issue that still now exists? That does not encourage patients to come back in. Or having discussions about whether a particular treatment is going to work, whether it's because of side effects, you know, having frank discussions about side effects and how that may interfere with the treatment. And are there perhaps older or even less effective treatments that we could start with that don't have those side effects? Those are all really important parts of this discussion. So they're still waiting on IRB approval for their research. But one of the reasons I'm here today is that I just wanted to start a conversation, because I know that every single person who works in the healthcare space has had experience with trust or lack thereof. So I thought that if people had questions, they could just ask and we'll start a discussion.
I obviously love this topic. I'm all about this topic in the last few weeks too. So thank you, Claire.
You're welcome.
I think like having a trustworthy health system is something we need to have in the next handful of years. So it's an incredible North Star for them. You know, I think a lot about trust, not trusting the system. Like I see a lot of my friends and family going above and beyond to not go to the doctor because they're scared of being put on what I call the healthcare conveyor belt. You know, they're going to get care that isn't aligned with what they need, or, you know, not addressing their needs, preferences, or priorities. So this, you know, the system has a long way to go in being trustworthy. Even though I can trust my doctor, right? And I remember I just had to have a toenail removed from an accident. So I drove to my friend's dad, 45 minutes away. I must have drove past 50 podiatry offices to get to his, because I knew he would take care of me. I trusted he would take care of me. I think the bright side of that is our health system has a unique position for establishing trust. Like we as patients almost have to trust the doctor. They have a product and service that literally we cannot live without. And we're forced into this, almost, it's like the health system could really beat us down, and we still have to trust it. And that's kind of how we found ourselves where we are today. But that is the bright side. I mean, I guess, like, if our health system started doing exactly what I as a patient needed and preferred and engaged me in that way, we'd be able to feel the difference. And it would establish trust like quickly, if you're really taking care of people's core concerns.
It would. And, one of the things that I try to work on is communicating that patients' goals don't necessarily match their clinicians' goals. They might not even match caregiver goals, but really it comes down to what the patient knows is right for them. And even if someone disagrees with that, it's still the patient's decision, right? That's the textbook definition of paternalism, when people decide that they know better and they make decisions for us, which that kind of paternalism goes back hundreds of years, and not just in healthcare. If you were at one point, if you were at a different, societal level, you got to decide what was best for the people who lived on your land. Also not okay. And we've evolved from that. But the healthcare system, you're right. One of the things that makes it even more complicated is that out of all the industries out there, these are where the stakes are highest, because it is literally people's lives. If they don't get the care they need and the care they want, somebody could lose a life. What?
So I just wanted to say, one thing that I always try to tell providers is that our families and our patients, we need to start building that trust with our patients, because working in pediatrics, that starts from the beginning, right? Especially someone who has a chronic illness. And you need to have those expectations that when you have someone who has a chronic illness, that during those adolescent years, those are going to be really tough years, and they're not always going to be as adherent as what we think that this should be. And we need to prepare for that and, have the right tools and give them the right tools to be able to manage that. But at the same time, this is a partnership. This is not a dictatorship. This is, yes, you went to school, you know all of the clinical aspects. What I want you to do is I want you to bring the information to me. I want you to be transparent with me, and I want you to give me options and help me make an educated decision that works best for my family, for my child, or my parent, and our situation. And, that's how we're going to have better health outcomes, by having those conversations and building those relationships. We talked about this yesterday on another collaborative that I'm on. Can we talking about giving providers bonuses for, raising, because everybody's worried about experience scores now too, right? I mean, it's all a part of the system. And, could we give providers bonuses to help them, be more engaged with their families? And my response was no. Giving them money to do something that they should already be passionate about doing in the beginning, yeah, it might work for a short period of time, but it's not genuine. And it's not going to be long term. Either they want it or they don't. And the way the educating of our medical students and staff, these have to be part of their core curriculum, is how to have these conversations and how to build these relationships.
Yeah, I agree. I'm actually trying to build curriculums in 3 separate areas, which is helping patients talk to their clinicians, helping the clinicians talk to the patients, and helping the intermediaries interact with both. I have no idea how to make it successful yet, but first of all, I think you're right in that it goes back to training. And part of the issue is that the folks who came up in our parents' generation are the ones who are teaching, the ones who are coming out of medical school now. And so there does have to be a fundamental paradigm shift. And that is always really hard, especially with entrenched industries. And the other thing I just wanted to comment on that you said was bringing it back to outcomes. It's something I forget sometimes because I'm a patient, and only a patient at this point, is that it's less expensive. When you can get buy-in from your patient in a trust relationship that goes both ways, they are more likely to respond to suggestions, even if it's more gradual than the clinician would like. And therefore you have healthier outcomes and you don't end up like me, who has at least half a dozen complications of diabetes, including kidney disease before I was 30. So I am a very expensive patient. I would not wish this on my worst enemy. And the way to do that is to build up trust in those relationships so people feel comfortable pushing back when it's not right for them, so that we can find alternate paths to treatment. Thank you.
I was just going back. I'm sorry, Stephen. I was just going back through some paperwork, digital files that I visited back in 2015, 2016 when I was on the engagement committee for PCORNet. And I think it was the spring of maybe March of 2016, we did a trustworthiness conference. Libby, you might have been around at that time. And I got some of the deliverables from that conference that I was just going through, and there were a number of key points that were brought up. One is that we tend to use language. At that point, it was a key thing that we tend to use language that isn't the language that our target audience speaks. And we need to speak the language of our audience, whether that's the language of a 6-year-old child or whether it's the language of a parent with only a high school education. We need to dumb it down sometimes without really dumbing it. And we need to do that listening and putting ourselves in other people's shoes. I think I still have the slide deck that they used at that. So if anybody wants it, take your email address into the chat and I'll try to copy you on the documents that I located today on that trustworthiness conference.
I would be interested in that. That was before I was involved in this space. Language is actually one of my specialties because it has to be informal but precise. So I will put my email in the chat. If you wouldn't mind sending me that, I would really appreciate it.
And Libby has her hand up.
Yeah, I just I think that the language piece is such a critical bridge to creating trustworthiness. And the more that I hear, some of the conversation, and the more that I'm just thinking about a prior conversation that I've had about the distinction between trust, like we all should trust our doctors, we should trust our health system. It's like something that we should be doing versus how do we help health systems build trustworthiness so that the system is evolving, whether it's education, like you were talking about, Claire, or bringing in efforts around diversity and inclusion, or whether it's about using person first language, Sherry, and really making it accessible for people. So I just, I don't want to put upon, it's like talking about clinician burnout and asking them to be more resilient. I want to change the system around to create trustworthiness so that patients and family caregivers feel that sense. But
and that's a good question. I think that goes to the heart of the model that the ABIM Foundation is trying to build at this point. To me, and I'm not a clinician, so I can't speak to this, but I would hope that things like shared decision making would actually take some of the burden off of clinicians, so that clinicians realize that the ultimate decision doesn't actually lie with them. They're information conduit so that the patient can make the decision. And perhaps that will increase some of the anxiety because they would have made a different decision. But I would hope that lifting some of that burden would help clinicians, but I don't know. But Kelly Rand and I, who's my contact at the foundation, we were talking about this. And we thought the biggest piece is communication. And it's going to be hard for hospital systems to be more transparent and have a higher level of communication. But it really is the heart of it, that even having difficult discussions with patients of that hospital system, when you can have a difficult conversation in a frank and open way, it makes the easier, less impactful conversations that much easier. And every conversation you have where the patient realizes that you're not holding anything back and that you're really putting all the options on the table is another step in that ladder of trust. So those are the two that we really thought were the communication part and really understanding that the patient is the final arbiter and can be trusted with what's best for them. And that's after going through everything. So love to hear other people's ideas though, because this is, again, I'm in a very narrow space.
So I have a couple of things to add to what everybody's been saying. I don't trust the healthcare system at all. I kind of have to, and I know they don't want people to self-diagnose, but you know what? I know my body better than you do. I know what I've put into my body. I know what I have done for my body. I know what I've lacked. I am the best advocate for my body. And some people may not know their bodies as well as I would. So in that sense, maybe, and this is the only thing I can kind of get in my mind to help this, because this is where I kind of put a little bit of my own trust. So when I call the nurse hotline and I'm telling them my symptoms on the nurse hotline, she then tells me, okay, based on this, you probably need to go do this, or you need to go follow up with your primary care. Now, if my information isn't up there for her to see, and all she has is my age and my weight and my symptoms, then she's going to probably just give me the care that I deserve, but she has no bias at that point. You know what I mean? And so I was able to build trust with that person. And then I was probably annoying because I'm asking all these questions, but she knew the answers. And I knew from there, when I went to the urgent care, what exactly I needed done. Instead of wasting my insurance money doing tests or telling me it's this and it's not that, I had to go and demand certain things because I knew, based on the advocate, I'm calling her, that I had to tell me, hey, based on your symptoms, you might want to look at this. Now, she's not my primary care doctor, but if I don't trust my primary care doctor, I'm going to go with the best out of the shitty options. So all I can think of is to maybe have advocates for people. So, of course, someone who you are comfortable with sharing your medical information with, but somebody who's going to advocate for you. Hey, based on your symptoms, they're supposed to do this test and, code this, code that. Because I know, for one, through my own experience, that there's protocols that they're supposed to follow based on people's age and health history. And when they don't follow them, people wind up with cancer that was undetected and they pass away within 8-9 months. True story that happened to me. So that's why I know that having an advocate who can say, hey, this is what should be done based on protocol. And then in addition to that, based on your symptoms. So it's not a primary care physician, not somebody you go through, but someone who I can say, is my doctor doing the right thing based on my symptoms? And that's if I have a problem. But if I don't have a problem, then I just really need to make sure my advocate is making me aware of things that I'm supposed to test for at certain ages, things that I'm supposed to watch out for at certain weights and heights, things like that. Put things on my radar so I can you know what, I I've been feeling a little pain right there. Maybe I should stop eating soda and not sitting around. I will get kidney stones. Thank you for telling me that. Now I can prevent it. And just from my experience, and this is my health experience, which is very different from most people because I am a colored woman and I'm a woman. It seems to be like you need to be dying in order for me to help you. I don't get preventative care, which I want. I'm a willing patient. Like, yes, I'm willing to do it. The doctor tells me to prevent these things from happening. So if I can't get that and I'm doing it myself, you know, I can misdiagnose myself, I can miss something. But if I had an advocate who, you know, might just check on me or I check in with them to tell me these protocols or these watch for to help me prevent certain things, then when I go to my primary care doctor, I am equipped with the right weapons, the right tools to get the proper care. So their transparency mixed with my advocating for myself kind of is the best that we can get until we fix the whole broken system.
So what I hear you saying is what you're looking for is kind of like a doula, but not for a pregnant person.
Yes.
Like that?
Yes.
One of the things Kelly and I were talking about bias. Of course, I can never have your experience as a woman of color, but I have had my fair share of experience as a woman, and even as a child, where they don't take you seriously. And a quick question, you don't really enjoy your relationship with your primary care doctor. Do you have the flexibility to walk away?
Oh yeah, but it just
that's
goes,
something
it's just, and I think it's just the network of doctors that I deal with because of Medicaid. So, you know, a lot of doctors don't want to take Medicaid patients because of bias and whatnot. Right. So I have to really be careful what doctor's office I go to and how I look when I go in the doctor's office and all kinds of sorts of things. So
I'm sorry that that's been your experience.
It's bad. So that's why I take a lot of passion for making sure we can get something done, because I know it's not going to be an overnight fix. It's a systematic issue, and if we can start here, you know, at least, you know, making people advocates for themselves, then, you know, that's better than nothing.
Yeah, and I suspect you're speaking for millions of people right now. I think this is not uncommon. So thank you for that.
Yeah.
I agree. I'm so glad you joined the conversation today and are bringing this, everybody, and bringing this perspective. A doula just for healthcare. That's a brilliant statement. I love it.
That's the closest.
Well, you're getting one person that you can trust. That's what I'm hearing, right? You find one person you can trust who has the knowledge and maybe a little bit of resource that is going to be helpful for your health journey, right?
Well, and you're finding a doula is somebody who is there because they want to be, not because they're getting paid all this money or this prestige or this rub shoulders with these people. No, a doula is usually like, I do this. They're proud of themselves. I do this well. I advocate very well. I take care of my patients very well. Those are the best doulas.
Yeah, Lindsay's brought up a great point in the chat too, the use of community health workers and the increased movement. Michelle, I'd love to hear about your use of CHWs.
Hi. Our organization has a really, really robust system in place. We had a massive network study kind of the view of our land, you know, our survey of our land, and part of our community health needs assessment really spoke to the fact that patients in general just didn't trust the network, and I think that it falls to a lot of different issues in the community, whether it be, you know, I think that we overlook a lot of things when it comes to the healthcare system. You know, it doesn't just start at trust. Sometimes it's, I don't have a ride to go to the doctor. I'm not going to worry about going and paying my copay because I'm worried about getting kicked out of my house this month, or I need to put food on the table for my kiddos. So I think, you know, missing out on those other social determinants of health above and beyond, you know, the relationship with your provider. There were so many barriers before folks could even look to attaining healthcare. So putting in that network has really helped that. We're able to, you know, bridge that gap, especially, and then through that relationship building, those individuals are able to come in and be that, you know, non-biased third party there with the patient to advocate and just kind of help start those conversations, because a lot of patients, you know, just really don't know where to even start the conversations. Or as Alana pointed out, you know, you can throw 8,000 things at me. I know what's happening in my body, like help me advocate and have this conversation. So it's been a really, really great program. It has become more and more robust over the last 2 to 5 years. So I'm really, really proud of our organization when it comes to the network of providers that we have in that aspect.
Thanks, Michelle. And that is actually part of the Avon Foundation's model. It's something they're calling implicit voice, which is all those factors, whether it's transportation or, like you said, paying your rent that much or that month, and all those things that keep people from going to get care that they might need.
For sure. I mean, and then, you know,
Yeah.
even small things like, you know, medications. If my doctor is looking at me saying I need this medication, it may seem like a small, you know, $10 is a small, I'm using air quotes here. I'm sorry, my camera isn't on. You know, $10 doesn't seem like much, but when I'm not sure if I can afford ramen noodles to get through until next Tuesday when I get my check, that $10 is a lot. And it doesn't matter that I need that or how much you've told me that I need it. It's not that I'm trying to be non-compliant. Again, horrible word. It's that I can't. So just having that advocate there is really, really important.
It's all relative. That's right. And you know, it's interesting because I was non-compliant, and I say that with full knowledge of what that word means. For 6 years, I knew exactly what I was doing, which was very self-destructive. But yeah, most people are non-compliant. They are incapable of being compliant the way the clinician would like them to be. Do you have information on your program that you could send? Because anybody who has a successful program, we'd love to take a look at it as we're building.
For sure, I can definitely reach out to them and see if they can provide me with something that's probably easily digestible for others outside of the organization. Yeah, for sure.
Fair enough. That would be great. Thank you. I'll put my email in the chat again.
Okay, great.
Thanks.
You know, I had one other idea I'll just throw at you, Claire.
Okay.
Listening on this, you know, as you're building your case for the foundation, and to look at I see our health system jumping in on mental and behavioral health now, and it feels a little bit like trying to throw a Hail Mary before we know how to block and or run the ball. Like we're never going to be able to really effectively treat people's mental and behavioral health challenges without trust in place, right? And you know, we've jumped on this. I've been screened for depression, sitting there talking about how excited I am for a upcoming trip, right? And it's really uncomfortable. So screening is not going to get us there, right? And I wonder, you know, looking at ways to implement some of the elements of trustworthiness, looking at mental behavioral health programs that kind of break that barrier a little bit. Now, just
I haven't had this discussion.
Off to the left.
No, it's actually really important. And one of the reasons I feel it's really important is, as someone who balances over a dozen conditions, every time you receive a diagnosis, it changes your identity, right? You're not even if it's something small, you are not the same person you were when you went into that appointment. And so for me, the ideal would be a prescription to see a social worker or a psychologist who has experience in the disease at the point of diagnosis. You can go once, right? Once and never go back again, but you know it's there. But there are issues with that too. Stigma being the primary one. But yeah, I actually agree with you. I don't think it's out in left field at all. I think that addressing mental health as we address physical health. In fact, I wrote a post about it a couple of weeks ago about how I don't understand why the discussion of physical health and mental health ever diverged. I get that the coverage diverged, but those two things should never have grown apart as treatment methods.
True. Very
But
true.
your mental health physically, it messes with you physically.
Absolutely,
Like,
100%.
that's why I focus on exercising and trying to eat right, because if I'm sick, I'll know right away. I feel good,
Right.
so I'll know right away. You
It's
know
the
what I
least
mean?
invasive treatment there is. That's right.
Yeah, yeah. I mean, and it's preventative.
Yes, absolutely.
Well,
it is.
I will tell you that, you know, I've been involved with the American Board of Pediatrics Roadmap Project. And for those of you who don't know, that's about building resiliency with patients and families who have chronic health conditions. And, you know, it's not about when a child receives a diagnosis, a life-changing diagnosis that is going to be lifelong. When they get that at even if they get it early at 2 years old, it affects the entire family unit. And it's important for us to remember that and check in and do it in a meaningful way, not just, hey, how you doing today? You know, it's about, how are you? Mom, how are you doing? How's the family doing? But we need to, and our hospital is doing a much better job. But we need to make psychology and psychiatry normal, part of the care team. So then that way it doesn't have that stigma. Because let's face it, I have children, all of them with chronic conditions. When you have a child who has chronic health conditions, that child is going to need to talk to somebody else in their life, regardless if it's adolescent or early adulthood. The family needs to have resources because, you know, that main caregiver is also going to need some support services. And it goes back to building that trust, but also making it normal, because we are seeing such a huge influx of younger and younger behavioral health cases coming in for treatment. And it is sad.
Well, even before, so I can actually illustrate this fairly well. I had meningitis when I was almost 6. My brother was 2. I still carried guilt that at the exact time when my brother should have been the center of attention, I had to be the center of attention for almost 2 years. And I'm sure there are some detachment issues there, but we've never discussed it because we don't have that kind of relationship. And then when I was non-compliant in my teens as a type 1 diabetic, and my mom would yell at me, "Why are you trying to kill yourself?" She didn't really have any support. And I don't know if anybody here knows how it feels to make your parents cry. I know how that feels. It's horrendous. And they, you know, they did everything. They even put me in a lockdown mental health facility for 2 weeks. It was the wrong step, but they were trying. And in a forum I was recently in for the state of Maryland, we were talking to caregivers, and they said that one of the things they really would love is an informal support group network, so that they had other people in their same situation, like peer support, that they could just go to and vent and really, you know, be frank and honest and get it all out, because it's hard and it's unique. So totally agree with that. I see that we're coming up on the end a little bit, and I promised Kelly I would make an ask of this group that I don't think anyone here will have, but might, and maybe they know people, and that is the Avon Foundation is looking for videos of people who may have made decisions based on misinformation. And if anyone wanted to talk about that, I've done a video or two for them, and it would really help if anyone has a story to contribute or knows anyone we might talk to about it. So that is my pitch for videos. Thanks, guys.
And
And
if
is this
anybody,
the sorry, I was just asking, is this the organization that is trying to bridge that gap of the
Correct.
transparency? Okay, okay,
Yeah, that's the organization that I'm working with. Yeah.
okay, gotcha.
and I just wanted to make the offer, if anybody would like to record a video and needs any support or use our Zoom, we're happy to support you guys.
Thank you.
That's helpful.
And Teresa, I saw your email this morning about your interest in this engagement opportunity. And since we have Claire here, do you have any questions about it?
Yeah, I'd like to actually know if I can offer this opportunity for any of my parent partners, because they definitely may be interested and could give you some good information. If not,
Yeah.
If not, I'd be more than happy to, but I would like to actually offer them the opportunity.
Yeah, absolutely. I don't think we have any limits on who can contribute. We're trying to talk to everybody who's got a story and wants to share.
Is there a time frame of when you need to know by?
I am not sure, but if there is, it's not soon. It's not like next week.
Okay.
But I can ask and get back to you.
I think you have my email address because you and I have spoken before.
Okay.
It's been a while.
Yeah, but that's okay.
I'll send it to you in the chat.
Okay, perfect. Does anyone else have any questions I might be able to address before we wrap up?
Different nuggets. This is Nancy. I'm in central New Mexico, about an hour away from the metropolis of Albuquerque. As to the separation between behavioral and physical health, decades ago, I said, what is this? My brain is a part of my body. I started showing symptoms at age 16, and 25 years later, actually got a diagnosis of bipolar that I don't know if they're calling it type 1 or type something else. I've been medicated for many years and I've been stable, fortunately. The other point I want to make is the scarcity of facilities. My primary person is only 7 miles away in what is labeled a rural clinic, but for specialties, I have to go into the city. I have an appointment this afternoon that I considered changing to make today a little less crazy and running around, and I would have had to wait till April 29. I said, no, I'll juggle. I don't know if the scarceness of medical people is really, if it's nationwide or if it's here because wages have tended to be lower. But here we are, one day at a time. And thank you for being this audience.
Yeah, thank you. I think it is nationwide. We're struggling to get the right folks to the right treatment mechanisms, and especially in mental health care. One of my closest friends is a psychologist, and she says that a lot of these online apps that are offering to pair folks with mental health providers are heavily recruiting. And part of that is the pandemic, because our mental health needs have skyrocketed. In fact, that might be the one tiny silver lining in all of this, is that when everybody takes a mental health hit, it becomes slightly less stigmatized. But yeah, I don't think it's just your area. I think it's a lot of areas.
Thank you. Any other last minute questions?
No, just to thank you, Claire. This is like exactly like what we're going for at Coffee Chats. I saw you get resources from 2016 from one advisor, some perspectives over here, the ability to, keep the work moving with your patient and family peers. Thank you for the awesome conversation and the work that around trust. I mean, it's a It's a really important North Star that has intense transformational power if we were to focus on transparency or trustworthiness. Yes, trustworthiness. And
Exactly.
you were great. Yeah, thank you.
Well, and thank you all for contributing, because we need a variety of perspectives. If we only get one perspective, it's not going to work. So thanks everybody who was here for contributing.
Thank you.
Yes, thank you for the invite.
Great job.
Thanks. And thanks for having me. I appreciate that too.
For me, it's 9 a.m. my coffee hour. So I can't imagine a better way to kick my Friday off. Thank you. Yeah.
Exactly.
Yay.
Oh,
I just said yay.
if anybody has any, yay. If anybody has any other topics like this that you want to bring to the PFA network in a coffee chat format, just like this, have a discussion and a conversation with other members in the network. We do have an interest survey that I will put in the chat right now. I don't have it up. I'll put it in the chat, and it's on our website as well. So feel free to go to our website and check that out. And we would love to have you present a future coffee chat. There you go. All right. Well, thank you everyone for joining us. We will see you all next month.
Thank you guys. Great conversation. Thanks, Claire.
Thank you. Everybody have a good weekend.
Absolutely.
You too.
Cheers.
Bye. Thank you, everybody.
Bye.
I enjoyed
Bye.
this.
Thank you.